Physical and occupational therapists working in the hospital routinely teach individuals after any abdominal surgery the best ways to move around to protect their incision, ways to modify their activity if their endurance is low, and how to look for signs of an infection that may require them to come back to the hospital. These services are not being given to women after a cesarean section, which is a major open abdominal surgery. So they have to perform these same activities once they return home, in addition to having to care for their newborn. I teach occupational and physical therapists to work with this patient population the same way that they would work with any other patient who has had an abdominal surgery. There are a few additional things that we add on for the cesarean section population to include some typical activities they would need to do for their newborn. But in terms of specifics, I teach how to get in and out of bed to protect their incision, best ways to lift objects such as their infant without putting any strain on their incision. I also teach the importance of assessing vitals, such as blood pressure, oxygen saturation, and heart rate. These are things that any acute care therapist knows how to do on a regular basis. They do this with any patient for any diagnosis. But with this population, we are really trying to assess how their body is physiologically responding to basic mobility. We don't want their blood pressure to go too high to lead to something called preeclampsia. Preeclampsia can lead to things such as strokes, seizures, or brain bleeds.